Well, we have wrapped up another week, and I want to start first with a word from the White House. President Trump said today the country will not close again. We know governors have the discretion to do as they see fit. Would Texas close again?
Listen, there are so many options that we have that we can take to make sure that the state is being managed correctly. First, the important numbers are that we continue to have downward trends in the positivity rate of those who test positive. We have a reduction today, and it seems like so many days, of the people in hospitals and those who are testing positive remains flat. And so our numbers look exactly the way we need in order to continue opening up. That said, understand this. We have two measures in place already to make sure we have flexibility to have corrective measures without having to shut down. A couple of quick examples, and that is what we have been doing for well over a month now. We have these surge teams. If ever there is a flare-up, it could be in Houston or it could be what we're dealing with in Amarillo right now, where there's an outbreak because of meatpacking facilities that leads to an increase in the number of people testing positive. We put surge teams to go out there, test everybody, and it leads to an increase in tests in the short run, but in a week or two, it begins to slow down. A second strategy we have is we want to make sure that Texas never winds up like New York did, where they ran out of hospital beds and they got concerned about ventilators. Look at Houston and the hospital capacity in Houston. It is abundant. The same is true across the state of Texas. Our hospital capacity has never been compromised. Now we are allowing more elective surgery to take place. That means hospital beds are going to be taken that otherwise were open over the past 2 months. If we had an increase in people testing positive, we would just ratchet back on elective surgeries to make sure we had plenty of hospital capacity for anybody with COVID-19 challenges.
So you're saying you would not close the state again if we saw major numbers across the state?
Right now, there's no need to be concerned about anything like that. There could be some need to stay the same and not open up more. So that dovetails into a very important message for your audience, and that is we will only be able to continue to open up so long as everybody in Harris County, everybody across the state of Texas continues these safe practices of washing your hands, distancing practices, wearing a mask. If you do that, we will continue to slow the spread of COVID-19, and we will be able to continue to open up in Texas.
It is Memorial Day weekend. How will the state help manage crowd control, potential crowds at holiday destinations like beaches and state parks?
Listen, whether state parks, for example, we have Texas parks and wildlife officers who will be at state parks, making sure that they are able to manage crowds at those areas. And the same thing goes with beach control and could be park control, everything. There will be people there making sure that things get managed. That said, it's so important for people who go out on Memorial Day. You're enjoying the ability to get out. The ongoing ability for Texas to continue to open up will be tied to how well we maintain these distancing practices. So go out, have fun, enjoy yourself. However, make sure you keep your distance from others so that we do not spread COVID-19.
Texans have done a good job, but are you concerned about the spread of the virus with regular travel allowed again in and out of the state?
So the decision about removing travel restrictions from other states was at the recommendation of the 4 doctors who advised our committee. They noted that the transmission rate in the states that travel was restricted from is basically the same as it is in Texas now. So there was really no health care reason to maintain those travel restrictions. And by eliminating those travel restrictions, it is an additional way that it stimulates our economy without spreading COVID-19 even more.
Governor, this week the state released separate testing numbers for antibody and viral testing. Why were those test numbers not separated or categorized from the start?
Sure. Well, from the start, we did not have the antibody test. That was a relatively new type of test that was added in. As far as I know, the first time we got data on the test was on May the 9th. And so on my instructions to the Department of State Health Services, I said it's important to get those separated out. And so they were only a part of the aggregated information for 10 days. During that 10-day, the good news is this, and that is the numbers were pretty much the same. There was a differential of less than 0.5%. Most importantly, the trends remain the same. In other words, the positivity rate decline was exactly the same with or without the combination, the two numbers. Also, very importantly, the antibody numbers was only about 6% of the total tests that have been run.
And there's no concern there with the difference in the numbers for the positivity rate and doing that math.
Exactly. And so that's one of the factors we look at. And so your audience can understand when the numbers were first put in on May the 9th, the positivity rate was on a rolling 7-day basis was 7.1%. It then went from May the 9th at 7.1% to 6.3, 6.8, 8.1, 6.2, 5.8, 5.8, 5.5, 5.7, 5.1, down to 4.7 on May the 19th, which was the last day they were aggregated. So my point is this: the downward trend in the positivity rate continued, even taking out the combination of the antibody tests.
A new model from a policy lab at Children's Hospital of Philadelphia has health officials now concerned about a potential second wave in places like Texas and Harris County. It projects a jump in cases to 2,000 a day by June. Are you concerned about these projections for Harris County?
I'm not concerned about those projections. They kind of sound akin to these studies that we saw 2 months ago about how we would have 200,000, whatever the number was, of deaths in the state of Texas that proved to be grossly wrong. That said, we do constantly remain vigilant about second or additional outbreaks, and we remain ready. We have strategies in place to deal with any type of outbreak, such as these surge teams, such as increasing hospital capacity, such as the increase in PPE supplies that we've been providing.
All right, Governor Abbott spending another evening with us here a week later after talking to you last Friday. We appreciate your time, sir. Thank you.
Thank you so much. Be safe.
You do the same.